Love you.
So today we're quite excited to launch the Athlone Vaccination Centre of Hope. We at maximum capacity can vaccinate up to 4,000 people at the site. We plan for 40 walk-through stations as well as 5 drive-through lanes. We will be commissioning the 5 drive-through lanes towards the end of August, roughly in about 2 weeks' time. We've employed 177 staff to in fact staff the site, and we really want to encourage people to come to the site because it's on the transport routes, the taxis drive past here, it's easily accessible, and we're excited to be launching this today. We will start vaccination tomorrow, the 17th of August. Mitchell's Plain has a very low registration. At the moment, it's at 26% of eligible people have in fact registered. Kalicha is at 27% of eligible people. So a lot of people from this very area have in fact not yet registered and therefore would not be eligible to come for their vaccination. We really want to encourage people to come to the site, even if they've not registered. We can register people on site here. And our plans to tackle vaccine hesitancy, which is quite a factor, quite a big problem right around the country. In fact, we're working with community organizations. We're making sure that we're getting the message out there to people that the vaccine is safe. We're working with trusted voices in the community, so religious leaders, community leaders, encouraging people to come to the vaccination site so we can vaccinate. We have sufficient supply of vaccines in the province, and we received 287,000 vaccines on Friday, and we'll be using those vaccines for this Athlone site as well. So we really ensure that there's an adequate supply line of vaccines as well.
So I think up to now, people think that vaccinations are a health issue. I mean, it is, because you want to protect your citizens from being in hospital and dying. So that is the health issue. But actually, the debate is now an economic debate. And if you see what's happening in countries where they've got their vaccination levels up to the 80%, they're opening up. They've got crowds gathering without masks. We need to be able to do that. And in December, if we have a 4th wave in December, that's the middle of the season, our tourism economy cannot deal with that. So that's why it's an economic discussion. The tourism sector must say, get behind this, because we need to be able to have business, we need jobs. Those people who are employed in the tourism sector, get behind this vaccination drive, because it's an economic discussion. It's so that we can actually get our borders open, we can attract people, we can say to people, we're vaccinated here, we're a safe destination, and we're ready for business.